And we are live.
Hi all, I'm Dr. Sushma, consultant pediatric rheumatologist, Chandray Rheumatology Hospital. Today, let's learn about childhood lupus, also called as SLE or systemic lupus erythematosus. Let's try to decode this disease by answering 10 of those questions. First being, what is childhood lupus? Childhood lupus or juvenile lupus or SLE. It is not a very known disease or very common disease, but it does happen even in children. It is an autoimmune disease that can affect various organs. So, when I say autoimmune, I mean that our immune system, that is programmed to protect us from infections, gets dysregulated and starts affecting our own body and causes inflammation and damage to various organs. When it affects a lot of organs and it is because of autoimmunity, one of those conditions is called as lupus. It commonly affects people around the age of 15 to 40 years, but it can affect people of any age and it does happen in children also. And in children, especially, it can take an aggressive course. And it's more common among girls than boys. It is 5 to 10 times more common among girls. So, because of the autoimmunity, it starts destroying our own body and causes inflammation and damage to various organs. The major organs that are affected in lupus are skin, joints, kidney, heart, brain, and many more. What are the symptoms of childhood lupus? Because it affects various organs, the symptoms can be varying. It can be anything, and it depends on person to person, and they may present with multiple manifestations. Children might have just prolonged fever, as in fever that is more than 100 Fahrenheit for multiple days, that is not responding to antibiotics, or it could be just tiredness or fatigability and being having low energy, not being able to do activities like before, having mouth sores and loss of hair or thinning of hair, poor appetite, weight loss. Also, there can be joint pain, swelling, or stiffness. This joint pain and swelling can be in multiple joints. Of note is that in the joint pain in SLE is not very aggressive or very severe. Also, there can be other involvement. Depending on the organ involved, there can be varied manifestations. Very important is the skin involvement. Skin involvement in lupus presents as rashes over various parts, especially over the face. Rash over the face is called as butterfly rash in lupus because it happens on bilateral cheeks and nose in the form of a butterfly. It is more commonly reddish in color and it gets increased on exposed to sun. Also, there are various other types of rashes that get increased when exposed to sun. Also, the skin of children with lupus have increased sensitivity to sun called as photosensitivity. And this rash, sort of rash, is very typical and peculiar in this lupus, and it has to be looked for. Also, there can be involvement of kidneys, which is quite common in lupus. There need not be symptoms to begin with. It can be detected. Sometimes it gets detected only on looking for it. When we do a urine test, we might see that there is leaking of protein in the urine. Rarely, this kidney disease can progress and cause kidney failure and present with other symptoms as well. Lupus can affect heart also. When it does, it causes fluid accumulation around the heart, causing the heart pump to fail and cause heart failure. When it affects brain, it causes fits and also headache and low mood and even depression. In the same way, it can affect multiple organs, including gut and blood vessels. So, how is lupus contagious, or does it occur in families? No, lupus is not contagious. It is an autoimmune process. That means our own immunity is attacking our own body. It is not an infection. Even though the skin rashes might look really bad, but it does not spread from one person to another. It is not a genetic disorder in that it is, we can't say that if parents have it, the children will have it too. But certain genes, which are more prone to cause SLE, can be passed from parents to children. So, what causes SLE? The exact cause for SLE is not known, but certain genetic factors, as described, and also environmental factors in the form of infections and hormonal changes can lead to the beginning of the process of autoimmunity. So, how do we diagnose SLE or lupus? So, based on the detailed history and thorough physical examination to look for these findings, and certain blood works in the form of complete blood picture, inflammatory markers, and autoimmune blood panel and imaging tests, we diagnose SLE. And sometimes SLE can also lead to low blood count, low platelet count, and low white cell count as well. Depending on the organ affection, we go on to investigate for that particular organ. If there is leaking of protein in the urine or the kidney involvement is aggressive already, we go on to test the kidney by taking a tissue from the kidney called as kidney biopsy. So, how do we treat this disease called as lupus? So, there are multiple treatment options available for lupus, and there are multiple medications that are available as well. Depending on the organ affected and depending on the severity of affection, and that which varies from person to person, doctors decide the medications that needs to be started. Along with medications, one more important thing is skin protection from sun. Why is this important in lupus? So in lupus, the skin of children in lupus becomes extremely sensitive to sunlight. In that, whenever we are exposed to sunlight, the UV rays causes damage to the skin. When it does, the cells of the skin, they die. The dying cells will aggravate this process of autoimmunity. In that, it not only causes damage to the skin, this autoimmune process goes in a vicious cycle and causes other organ progression as well. So, protecting the skin from sun is extremely important in lupus. So, sunscreen with the sun protection factor at least more than 50 needs to be applied frequently, at least 30 to 45 minutes before going to the sun. Sometimes even daylight can cause damage to the skin. So sunscreen needs to be applied even whilst at home during day. When going out in the sun, carrying an umbrella and using rounded hats, covering sleeves and trousers are extremely important. Along with other medications that may be in oral tablets or injections, there are multiple physical and therapy and also regular exercises and healthy lifestyle which plays a crucial role in management of lupus because even mental stress can aggravate this disease. Doing regular exercise, being active, and doing meditations and be having a healthy lifestyle is very important in lupus. Can it be cured? Uh, Lupus with good treatment and good follow up, it can be kept under good control. Even because lupus, it is a problem with the immunity and it can be long term. So, even Though it is long term, with good treatment, the disease can be kept in remission. But flare ups can happen. When they do, timely intervention can keep this disease under control. How does this lupus affect lives of children? So when there is lupus, children might have low energy, feel very fatigued, and also since it affects young adolescents, girls especially, and with these skin rashes and hair loss, it can affect their mood as well. And taking the medications daily and joint pain and other organ problems can affect the day-to-day life. What is the prognosis of lupus? With timely intervention and good follow up, children with lupus can lead a full and active lives. Even though the flare ups can happen, by knowing the disease, by understanding the symptoms, and reaching out and starting the medications and keeping a good follow up, we can keep this disease under full control and the prognosis can be good. How can we support children with lupus? By knowing about the disease, by spreading awareness about the disease among others, and also understanding the patient's concerns and being understanding to the child's problems and being patient with them and encouraging them to do physical exercises and meditations and following up with doctor and being compliant with the medications, it is extremely important. Thank you.